Hello, hi guys, thank you so much for coming to my live Q&A. Firstly, I just want to apologize for the delay. Honestly, I am not used to doing these lives, especially on YouTube. It's like a whole different ball game. I had like a software set up, I had like a fancy presentation and all these effects, and it just wasn't working. So I just had to just think on my feet, and I just decided to use my phone to do the live stream. So I hope it will be okay throughout the live. Feel free to interact, and I just wanted to thank you guys for still waiting and coming. So, the reason why I decided to do this live stream in the first place was because of this Twitter trend. So, basically, on Twitter, they had a trend going on about how it started versus how it's going. So, I decided to do the trend, and I sort of shared my story about not getting into dental school and where I am now. And that actually got over 3,000 retweets and like 30,000 likes, which was something I was not expecting. So off the back of that, I got loads of questions about dental school, and people were asking me about advice and tips. And I just thought, you know what? Let me do a live. I didn't know YouTube lives were going to be this technical, but we got here in the end, guys. So thank you so much all for attending. Okay, so on my Instagram, I actually had a Q&A box, and I asked people to ask me some questions about what they would like to know. And you guys, you submitted your questions, and I've got them all on here on my laptop. So excuse me if I'm looking down because I'm looking on my laptop. So I'll be going through those questions, but feel free to chip in. I know some people are already asking questions now in the chat box. I'm going to go through all the set questions first. And if you do want to interact, then I'll go through the questions in the chat at the end, if that's okay. But feel free to type, interact with each other. You can also help each other with questions as well. But yeah, so I will get into it. So the first question that I got from Instagram was from Sarah Okinedo. Excuse me if I pronounce any of your names wrong, by the way. I'm just going to be reading the Instagram names. But the first question she asked me was, how's your new life as a dentist? So if you guys don't know, I recently graduated as a dentist, and if I'm being honest, it has not been what I've expected. Obviously, it's been a bit crazy because of coronavirus, so things have been really different, and it hasn't been the kind of dentistry that we were expecting to walk into. Because usually when you graduate, you'd be able to start seeing patients straight away. You'd be seeing sort of like, what, 15 to 20 patients a day. My first month, I've only seen a few, so it's been really difficult because of coronavirus, the new PPE measures in place, and the amount of checks that we have to go through. So yeah, my life as a dentist at the moment, it's not how I thought it would be, but you know what, I am super happy, and I'm grateful to just be in this position. And you know what, I'm looking forward to the months ahead. So thank you for your question, Sarah. Okay, so the next question is by Lisa Masani, and she's asked me, what A levels did you get, and do you have any advice for someone about to start year 12? Okay, so in terms of A levels, I actually didn't do A levels. I done the IB. So the IB stands for the International Baccalaureate. So the difference between IB and A levels is the fact that you have to do 6 subjects instead of 4. So I had to do chemistry, biology, psychology, maths, English. I done drama. There was loads of subjects. So I done the IB, and if I'm being honest, A levels are the hardest 2 years of your life. When I done the IB, I think it was really difficult. Like, you have a lot of pressure. You've transitioned from secondary school to obviously sixth form or college. And I find my advice to you guys, if you're in this stage where you're doing your A levels, you're doing your IB, I think it's just really important to just focus on getting the best grades you can. Obviously, if you guys have been watching my YouTube channel, you know what happened with me. I was 1% off, which is why I had to sort of do a gap year to retake one subject, and it was a bit of a nightmare, to be honest. So I'd say my advice to you guys would be to just really focus. It's only 2 years, and those 2 years are crucial for getting you into university. So I say really focus and try and have a good balance as well, because I think it's really important to have a good like study and just like work-life balance, because it can be really easy to just focus on studying and just be studying 24/7. I was such a nerd in sixth form. Like, if people would ask me to come out, I'd make up excuses because I just wanted to study. But at the same time, it's important to try and have a work-life balance as well, because you don't want to get overly stressed and just cause yourself to do badly, if you know what I mean. I've seen that there are some questions in the chat. So because I had a few questions from Instagram, but I know that there's some people in the chat as well asking. So I'll quickly answer one of the questions from the chat. So somebody's asked me, what dentistry university interviews are you aware of, how they work, and can you explain them? Okay, so they're both questions about interviews. What I'd recommend is that you watch my video. I've actually got a YouTube video all about the dentistry interview. I go into a lot of detail. So my advice to you would be to watch that video. But just for a general advice about interviews, it depends on what kind of interview you have. So with dentistry, you have the MMIs, which you have different stations. So it's multiple mini interviews where you have different stations. And then you have panel interview, where it's sort of like one-on-one. So I had a panel interview. So when you have a panel interview, the techniques that you're going to have for a panel interview are going to be much different from an MMI. But I do go into detail about this in my YouTube video on interviews. So if you want to find out more about interviews, go and check that one out. So I hope that helps. Okay, so next question from Instagram. Okay, so the next one is from Abby Monaghan. So she's asked me, how did you deal with being rejected the first time you applied? Every time I think of this story, it just, I don't know, it just gets me. You know what, at the time I was so like disheartened. I didn't even think I was gonna like get into dental school, because I had tried so hard, you know, when you put all your effort into something. And I'm the kind of person that I would give it 100%. And to find, like, the first email that I got was a rejection, because you know when UCAS sends you, they'll send you an email saying something has changed. And the first thing I got was a rejection, and I think it was from Bristol. And Bristol was one of the ones that I really wanted to go to. So I think when I first saw that rejection, I just, I'm quite a softie, so I just literally broke down into tears. I was like, oh my gosh, why am I getting rejected? And that's when I asked them for feedback. And they actually sent me some good feedback. They said that my academic record was good in terms of, like, obviously you all need good GCSEs, etc., good A-levels. But it was like my extracurricular activities. So they wanted me to have like more shadowing, more work experience. So I took that on board. So if anybody does get rejected, and if you're applying this year, I would definitely advise you to ask them for feedback, because I didn't think they would respond to me, I'm not going to lie. I thought I'd just send that email and just see what happens, and they actually did respond, and they gave me some useful feedback. So I think it'd be really useful for you guys to just, if you are applying and you get rejected, don't take it to heart, because dentistry is such a competitive degree by nature, and people are going to get rejected. Like, you're very what is the word, you're all students of a high standard, you know, you have good grades, and you're all very determined. I've read loads of personal statements this week, and reading those personal statements, I can see you all have the desire and the passion and the fire to do dentistry. So I think you're all very good, but it's just everyone can't get a place, and that's what you have to understand. Not everyone can get a place at dental school, and people are going to get rejected, and very good people are going to get rejected. I know a lot of people that applied and they didn't get in either, and their applications were great. So I think don't take it to heart. When I got rejected, I think I really did take it to heart. I was really upset, but then I just decided, you know what, this is what it is, and I'm just going to try again. You know, I think a lot of people don't like the idea of having to sort of take a gap year or redo subjects. just do it. You know, at the end of the day, it's 1 year. In the grand scheme of things, a year is not going to mean much when you look back. So now when I look back at that and I think of, oh, it was just a year, it was just a year out, and now the place that I'm at, I would take that year any day. You know, I think at the time it can seem quite daunting when all your friends are going to university and you're just you're not you're the one missing out. You know, you feel like you've missed out, so it can be quite daunting and upsetting, but I think in the grand scheme of things it will work out. So sorry, I've gone around a tangent, but to answer your question, Abby, how did I deal with getting rejected the first time? Yeah, I didn't deal with it too well, if I'm being honest. But now I look back at it, I think it definitely did help me grow as a person. By the way, guys, it is a live stream, so if you guys want to interact, feel free to write in the comments box anything that's on your mind. I can see there's quite a few of you on here, so yeah, just feel free even to say hi. You know, I don't want to just feel like I'm speaking to myself. So yeah, feel free to just type something as well as I'm speaking. Okay, so the next question is by _hair by AH. So she's asked me how to maintain resilience when resitting and reapplying. Okay, that's a good question. It kind of links to the previous question. I think how to maintain resilience, I think you have to just sort of accept that you're resitting. Oh, so I've just seen Abby's just typed now saying thank you for answering. No problem, Abby. Thank you so much for tuning in. I really appreciate your questions, and it's lovely having you. And yeah, I'm seeing your comments now. So Olivia's just asked me, were you rejected due to the interview or your personal statement? So they rejected me before they even gave me an interview, which was a bit harsh. So it was just, they said that my personal statement was the only thing that was missing was I didn't have enough work experience. So that was the main thing. And so the following year, I made sure that I got lots of work experience, and I messaged all the dentists that I knew. I sent so many emails trying to get as much work experience as I could. And one thing is, they don't care. I think it's about what you learn from the work experience, because I think before, in my old personal statement, I had like just a week of work experience, and I don't think that was enough to learn from. So that's kind of what let me down there. So yeah, I hope that answered your question. Yeah, if you guys have any more, feel free to type it in the box. So yeah, I'll get back to the other ones. So yeah, so Hair by Yay asked me how to maintain resilience when resitting and reapplying. I think you have to sort of just accept that this is the situation and just go with it, you know. You're in this situation now, you're reapplying, you just sort of have to just say, okay, this is the situation and I'm just going to keep on going. And I think one thing that really affected me was caring what people thought. I think it's really, really important not to care what people think. People might look at you some kind of way and be like, oh, why are you like taking a gap here? Why are you having to retake a subject? But at the end of the day, it's your life. It's not their life. I know there might have been people that were looking at me when I went back to do the subject again, and they were probably thinking, oh, why is she here? Why is she taking a year out? And at the end of the day, look where I am now. I'm not trying to be boastful, but I did go through the 5 years and I did get through dental school. So I think at the time you can get people just telling you a lot of negativity, and you just have to just ignore the negative voices and just keep your mind focused on the goal, and have a supportive group around you. I think that really, really helps. If you're taking a year out, if you're recent, have a supportive group of friends, a supportive network that can just really encourage you and just keep the fuel, keep the passion within you going, if you know what I mean. So yeah, that's that one. Okay, so we've just had a question in the chat box. So Bob has just said, hi, I'm trying to pursue dentistry and I'm in year 12 right now. Do you think I should do work experience during October half term, and what type? Thank you. Okay, so if you're in year 12, yeah, I think any work experience is great work experience. And if you can find a dental practice that will have you over the October half term, I definitely say you should do it. It can be a bit difficult with dental practices at the moment because of COVID and all the rules and regulations. So I don't know if they're going to be accepting as many students for work experience. But if you can get work experience in like a busy NHS practice, I don't know how busy they're going to be at the moment because of Corona. I really do feel for you guys. A lot of things have changed in terms of work experience, but I feel that the admissions team, they should be more understanding of your year group, the people that are applying this year, because I feel like it's going to be really, really difficult for you guys to get work experience. Because I know the practice that I'm working at the moment, they're not seeing any new patients, they're only seeing emergency patients, and things are a bit slow at the moment. So to answer your question, Bob, I think you should try your best to get work experience in a dental practice. If not, maybe try and volunteer at the hospital if they need any volunteers, even if it's not dental related. Anywhere that you'll be able to sort of communicate with people and get sort of interpersonal skills, because at the end of the day they want to know about your skills, whether you have good communication skills, good leadership skills, and you can get that from various types of work experience. Okay, so you've just said I've tried all the places and they've all said no, so should I work at a shop like a care house? Yeah, you know, if you've tried as many dental practices as you can, then do try and look for alternatives. At the end of the day, you want to try and get experience in a place that can help you develop your sort of communication skills. Ideally, you'd want a dental practice, but as I said, in this coronavirus climate that we're at in the moment, it's going to be very difficult to get work experience in a dental practice. But just keep trying. Maybe hospitals, they might be looking for volunteers, or maybe just any other sort of role that involves communication. So I hope that helps. Yeah. Okay, so Olivia just said, what do you believe are the most competitive unis for dentistry? You know what? I'd say they're all quite okay. You have the universities that, okay, like King's, for example. I'd say King's is quite competitive, but I don't think there's like a bad or like a good dental school. They're all really good. I've got loads of friends from different dental schools, and I feel like the teaching is quite similar. Obviously, you have dental schools that are a lot more modern. I'm always gonna represent Plymouth Peninsula Dental School. I loved it there, so I'm a bit biased. That was like the newest dental school. So all dental schools are gonna vary, and they're all gonna be very competitive. There's about 13 or 14 dental schools in the UK. So they're all gonna be quite competitive. So I think obviously the ones that are well known for being competitive is King's. But apart from that, I feel like they're all very good, and at the end of the day, you're all gonna get the same degree. So I wouldn't get too bogged down about whether it's like a Russell Group university or if it's like, I don't know, you know, like I think all dental schools are great, and obviously they can vary, but I remember when I was applying, I was thinking, oh, like let me apply for like a Russell Group, but at the end of the day, medicine and dentistry, you're all going to get a degree and it's going to be useful, so don't get too bogged down about the university. Being on live is so, I feel like I'm just talking, guys. So I'm going to have some water quickly and catch my breath. Whew. Okay, so I'm kind of like bouncing between the preset questions that I had on Instagram and the ones on the chat. So I'll take one from the preset questions and I'll come back to the chat, okay? So that way I can sort of answer both. Okay, so I'll go back to the preset questions. Right, okay, so from the preset questions that I got asked, hey, it's Shivani on Instagram, asked me, which unis did you apply to both times? Okay, so I applied, I can't remember it, like it was like 6 years ago now, it seems so long ago, but I know I applied to Sheffield, Liverpool. The first time I didn't actually apply to Plymouth. I applied to Manchester and Bristol. So I think it was Sheffield, Liverpool, Manchester and Bristol. And then for my insurance, I put biomedical science at Warwick. So those were my options. The first time round, I got rejected from Bristol. I got rejected from Sheffield, but Manchester and Liverpool actually gave me an offer. But I was 1% off on one of my exams, so I lost those offers, and that resulted in me losing my place. So it was a bit difficult the first time round because it's more annoying when you have two offers ready, waiting to go, and then that 1% just ruined everything. And I just remember how distraught I was. And I was so close to giving up, but I thank God I didn't. The second time round, I applied to, I think I applied to Manchester again, Liverpool, Sheffield. I didn't apply to any London universities because I just wanted to get out of London, if I'm being honest. I think when you've lived somewhere for your whole life, you just want to go to somewhere else. So I didn't apply to any London universities. I just applied to all the universities outside. And Plymouth was, I didn't apply to Plymouth first, but I applied to it the second time. And they were the only one that gave me an offer the second time round. So Plymouth was like my saving grace. And I'm so happy that I applied there. So yeah, thanks for the question, Shivani. And I wish you all the best of luck. Okay, so back to the live chat. Oh, you guys are really going in with the questions now. Okay, so Sally's98 said, which year did you find the hardest? And do clinical years have a lot of lectures? Okay, that's a good question. So in terms of dental school, I think the hardest year was actually second year, you know, when I actually think about it, because first year you're just sort of getting into it, you're learning about the basics, you're not really learning about much clinical dentistry in first year. You're mainly learning about how the body works, anatomy. A lot of people think you're just learning about teeth. Dentistry is not just about teeth. I just want to say it louder for the people at the back. Dentistry is not just about teeth. We have to learn about the entire body, anatomy, histology. So in the first year, we learn about all of that stuff. And I think because you're very eager in first year, you're sort of on the ball, and I think a lot of us were just really just happy to be in dental school. Second year is when it starts getting a lot more difficult because you've learned the basic concepts, and then you have to sort of develop on it, and I think it's just tying everything in together, because all of these things are just brand new, they're fresh. Obviously dentistry is not something you can sort of learn in A-levels, you know, you can't take dentistry as an option, so you're learning these fresh topics and just trying to tie everything together. So I think second year was the hardest year, and it actually got easier actually. I think the more we started doing clinical work and the practical work, it starts getting easier, guys. So from third year onwards, I think the more I was actually doing hands-on dentistry, I really started to put the theory and the practical aspect together, and things just started making sense. So it's really weird because I found final year quite, I wouldn't say easy, nothing's easy, but I thought final year was the year that I enjoyed the most, because by that time I had sort of learnt all the theory, and you'd practiced a bit more, and I think by final year I did feel a lot more confident. So yeah, I think as strange as it sounds, final year was one of my favourite years, and you'd think that would be one of the more stressful. It was quite stressful, I'm not going to lie to you, but I think all the concepts came together, so I did really enjoy it. But yeah. Oh, guys, sorry, I know I don't even seem like a nervous person, and a lot of people think I'm just like this confident person, but it's actually quite nerve-wracking being on live, so just bear with me. Yeah, just keep on asking your questions, and we'll be going through it slowly. Okay, I'm gonna have another sip of water. Thank you, guys. 1 second. Whew. Right. So I hope that answered your question, Sally. Okay, so I'll go back to the preset questions. I'm trying to happen to go back and forth between the chat and like the preset questions. So, right. Okay, so Toya Zomaka, so sorry if I'm pronouncing your name wrong. So she asked, what are your top tips for dentistry applicants? Okay, so my top tips for dentistry applicants. So first things first, obviously you want to make sure you know the reason why you're doing dentistry. I think if you're doing dentistry because your parents have sort of forced you to do dentistry, or because you think that you're going to make so much money as a dentist, people have all these sort of ideas about what dentistry is, but they haven't thoroughly researched it. So if you're doing it for those sorts of reasons, I think you'd really need to just examine your intentions. And I think that's why I think work experience really helps, because you're able to actually see what a dentist does firsthand, and you're actually able to make that decision for yourself. So I think one of my tips would be to really understand your intentions and your reason for doing dentistry, and that will really show through on your personal statement, because they've gone through, if you think about the people in admissions, they've gone through so many personal statements, and immediately they'll be able to tell whether someone's being genuine or not. So I think you need to read, my top tip firstly is to know exactly why you are doing dentistry and whether it's something that you'd want to commit to for the rest of your life, because it is a massive decision to commit to something for the rest of your life. So you need to really decide and think, okay, is this what I want to do? Okay, so that's that one. And then once you've done that, obviously your personal statement, get your UK CAT done, which I'm sure you guys have all done, the UCAT. So it would be really good to get a good score in that. And then I think the biggest tips when you're applying is the interview. Obviously I go into a lot of detail in this in my YouTube video on interviews, but your interview is really important, because that's when they really get an impression of who you are, and you're able to just allow your personality to show, because obviously they've just seen your personal statement, but they haven't actually met you as a person. So I think my biggest tip would be to really make sure that you are prepared for your interview. Obviously this year I don't know how it's going to be with interviews because of COVID. Obviously I don't know if they're going to be doing interviews through Zoom. I'd like to hope not, because you can't really get a good impression from someone if you're doing it online. But hopefully you guys still get face-to-face interviews. So yeah, hopefully that still goes ahead, because that's a very important deciding factor. So I'd say really make sure you're prepared for your interview. Get a lot of rest the night before. Practice. That is my biggest interview tip. Practice makes perfect. I remember I was practicing in my mirror. I was like, if anyone walked into my room, they'd probably think I was crazy. The amount of times I'd practice, like, hey, why do you want to do dentistry? And just making sure that they can get your passion can get across, basically. So just practice. At the end of the day, practice makes perfect. I know it's such a common saying, but it really does. The more you practice, the more confident you feel, because I haven't always been confident speaking in front of cameras. Like, even doing this does still feel a bit weird, if I'm being honest. I am not the most confident person in the world, but I think you sort of just have to, even if you're fearful and you don't feel confident, just pretend and you will feel it. Like right now I'm like pretending like, yeah, I'm confident, I'm doing this live, but I do get nervous at times, and I think it's normal for everyone. We're all human beings. So I think just, even if you are nervous, just try and just allow your personality to show, because you only get one chance at your interview. So I think that's the biggest advice and tip that I'd give you guys. Practice for that interview, because yeah, practice. I can really go on and on, guys. Thank you for still watching, all of you guys that are still here. I really appreciate it. If you are enjoying this live so far, hit the like button below. Yeah, I'd really appreciate that. Okay, now next question. Sorry guys, my laptop's here, so I'm just looking over here. Okay, so Krisha has said, what is the best way to revise for first year? Again, I've got a YouTube video all about tips for first year, so go check that out. But I would say the best way to revise for first year is to make sure you have organised notes, because I think you have to decide whether you're a digital note person or whether you like written notes or you're a combination of both. So I would bring my laptop to the lectures because I like to type things up because I find that if I write it down on a piece of paper, you can easily lose it. So I think decide what kind of learner you are. Do you like written notes? Do you like looking at it digitally? Do you like drawing? So just find out how you learn. So I started doing my notes on my laptop, and I think it's just really important to just make sure that you're keeping on top of your lectures in first year especially, because you're going to have loads of lectures, you're going to feel really overwhelmed, but you have to make sure that after each lecture you really do sit down when you get home and go through it, because it's very easy to get overwhelmed and bogged down by it all. So as much as you might want to just leave it all to the end of the week, it will pay off in the long run if you do a lecture, write it up, and I think that's the best way to learn, because then you're able to identify any gaps in your knowledge straight away. So I think that's the best way that I learned in first year, and I think YouTube videos are so helpful as well, because your lecturer can say something and you might not understand it in that moment, but I found YouTube videos to be extremely helpful. I think there's a YouTube channel called Mental Dental that I used quite a lot when I was revising, so do check them out. Mental Dental, they're really good. And there's such, I feel like we're living in a day and age now where there's so much knowledge and there's so much online free available to everyone. So I think if you're ever struggling, there's always help. Even if it's not online, I think it's really good to study with your friends as well. So I had quite a close-knit group of friends in dental school, and we had like a WhatsApp chat and would always message each other if we ever found anything difficult. So I think it's really important to have a supportive group of friends that you can ask for help, and don't ever feel embarrassed to ask for help, because everybody struggles, everybody needs help once in a while. So get a supportive group of friends, find the best way that you learn, and you should be fine. So yeah. Okay, so the next question we have is from Meisha. She said, what's your most and least favourite thing about dentistry? Good question. You know what? I feel like there's so many things to love about dentistry, like the patient interaction. You get to literally see patients from the beginning to the end, and there's not a lot of healthcare professions where you're able to sort of see a patient from the beginning and just sort of see them through the rest of their life. The practice that I'm at now, one of the dentists, they've been working there for over 40 years, and they've seen like their patients through it all, you know, the highs, the lows, and you're able to sort of develop that relationship with them. And I feel like your smile is one of the most important things. It's one of the things that people see, you know, one of the things that people see first. And I think just being able to sort of help people with their oral health. I'm such a nerd when it comes to oral health. Like whenever someone asks me about like toothbrushing techniques or like any oral health advice, I'm like, yeah, do this, that. And I think it's really important because I feel like a lot of people have they don't have enough information, or they have just sort of miscommunication about dental health. I don't know what it is, but it hasn't been communicated effectively. Even simple things like not rinsing your mouth out after brushing, like you're not supposed to do that. You're not supposed to rinse your mouth out with water after brushing. And the amount of people that I have told that information to, they find that really shocking. Obviously, because you have to keep the fluoride in and keep the toothpaste in for as long as possible. So I think it's really nice when I'm able to sort of provide that education to people and just enlighten them and give them advice about their oral health. So I think one of my favourite bits is the education aspect. I really enjoy sort of teaching people about their oral health and ways that they can improve and things that they might not have known before, and just being able to just improve. I know it's something that people do say a lot, but like just improve people's confidence and generally have an impact in people's lives, because you don't understand how much your teeth can affect your confidence, the way you perceive yourself. And I've seen it in patients. When I had some patients in dental school, they wouldn't even, I had one patient, she wouldn't even smile in public because of her teeth. And she came to the dental school and she just wanted to be able to smile. So something as simple as that, I think it's just, you're making such a huge impact in people's lives. So yeah, that's I feel like I've said like 10 favorite things that I love about dentistry, but yeah, I feel like dentistry is super important. And yeah, my least favorite thing about dentistry, I'd okay, I think at the moment, I think it's just the time pressures. I think sometimes you have to, especially within an NHS setting, you have to sort of, you don't have as much time as you would have liked to see your patients. And I feel in dental school, you've come from dental school where you have sort of 2.5 hour appointments, and I love having long chats with my patients, but I think it's quite difficult to transition to sort of like a setting where you have to see like 15 patients in a day, and you don't get that sort of one-on-one that you'd usually get. So I think I just don't like I don't like that aspect of it in terms of like in NHS practice, and just not having enough time to spend with your patients. But that's not, obviously when you start moving on to like private practice, you are in charge of your own schedule more. And I feel that one other thing that I do find a bit, I feel like within dental school especially, like the competitive nature, I think within dental students they can be, obviously you're all really high achievers, and I feel like the competition within dentistry can be a bit much. And I think that's one of the things that I didn't really like as well, because I'm the kind of person where if I have something, I'd share it with you, you know, like why would I withhold it, you know? Like I feel like if you give to others, it will come back to you. That's just how I believe, you know. But I feel like it can be quite a competitive field. So okay, that's what I'll say for that. Time for water again. Oh my gosh, guys, I've been speaking for 37 minutes. Thank you guys who are still here. I really appreciate it. Okay. So next question. We'll go back to the preset questions. Okay, so one that I got from Instagram was from RTM_DP. He said, any advice for someone unsure about whether they want to get into dentistry or not? Okay, so I think you need to make that decision about whether you would enjoy dentistry. That's one of my main things. I think if you can see yourself enjoying it and you have work experience in that area, obviously in this climate it's going to be difficult, but I think messaging dentists, I know quite a lot of people do message me to ask me like how I find dentistry. I think in this day and age you guys have so much access to dentists on Instagram, you can email dentists, so I think you have to sort of really take the initiative and just try and get as much information as you can about dentistry, and then you can make a decision about whether it's something you can see yourself doing, because I think it's really important that you can see yourself doing something. And then from then onwards you'll be able to decide whether it's something that you'd want to do. And obviously try and get experience in different areas as well. If you're torn maybe between dentistry and medicine, maybe try and contact some doctors, or try and get some experience shadowing a doctor as well. I actually have a video called Medicine versus Dentistry that I recorded with my friend who is a medical student. So I'd advise you go check out that video after this, because we do go into more detail about the positives and negatives of each career. So yeah. Okay, so Balfa has just asked me, do you plan to specialise in cosmetic surgery and implants? Okay, so I think it's too early to decide exactly what I want to specialise in. I think I'm just going to try and see what I enjoy doing. At the moment, I am enjoying doing sort of composites, cosmetic work. So obviously we don't get a lot of exposure to cosmetic dentistry when you're doing your foundation training, but you do get the odd composite here and there. And whenever I do a composite, I really do like the fact that I can sort of just it almost feels like art, and I do like that aspect and the creative aspect of dentistry. So I may decide to do cosmetic dentistry. I do enjoy it, but I think at this moment of time it's just better to get experience in different aspects before I make a decision. It's early days, you know, I'm just enjoying being a dentist at the moment before I decide what I want to specialise in. But we'll see where life takes me. We will see where life takes me. Okay, so Dentally Priscilla, who also has a YouTube channel, so she sent me a question on Instagram, saying, what's something you didn't expect about being a dentist? I think the main thing I didn't expect obviously would be coronavirus. I didn't expect that I wouldn't be doing as much dentistry as that I was expected to do last year. So things have changed a lot, and I didn't expect to be 1 month into foundation training and only seeing like 2 patients. So I think that's something that I definitely didn't expect. But everything else, I think you do sort of prepare yourself for it, and I did try and get as much information as possible from other dentists about what life after dental school would be like. So I think I was pretty prepared about what I was stepping into. So yeah, I think the main thing that I didn't expect was, I think none of us were expecting, was how coronavirus has changed foundation training so much. But yeah, thank you for your question. Okay, so I think we've just got a couple more questions from the Instagram. If anyone else has any questions to ask in the live box, just feel free to pop it in, because I know it is getting late now, so let me know. And yeah, so I'll answer one more question on the Instagram questions, and then if I don't get any questions in the chat, then we'll just finish that up. Okay, so the last question here was from Ria Man, and they asked, how do you deal with angry patients? Okay, so that's a good question. Well, you are going to get angry patients, that's inevitable, but I think the most important thing is to stay calm. So if you do get an angry patient, I think you need to just try and understand why they are angry. If it's anything that you've done, if it's anything that you can change, try and get that understanding and find out why they're angry, and then you'll be able to pinpoint and then go from there. So just make sure that you're calm. Obviously you're not going to get angry as well, because that's not going to solve the situation. So just make sure that I think it's really important to just try and solve the situation at hand before it escalates. So yeah, luckily I haven't had to deal with any angry patients yet, and I hope I never have to. But if I was in that situation, I think the main thing would be just to remain calm and try and understand where they're coming from and reach a mutual understanding. So yeah, okay guys, I think that's the end of it. If anyone has any final questions, just pop them in the box. If not, then thank you so much guys for tuning in to this Q&A. And if anyone here is sort of applying to dental school, I really do wish you all the best of luck. And if you need any advice, if you need any help, please just feel free to message me. I'm always here to provide a helping hand, because I know exactly how it feels to be in that position. So yeah, let me know. Okay, we've just had 2 more questions pop in. So King Snow has just said, where in Nigeria are you from? So I was born in Lagos, and I've lived there since, I lived there since I was 3 years old, and I came to London. And yeah, Nigeria, I don't remember a lot from it, but I have gone back to visit, and I do hope to visit again. And Michael just asked, what has been your most complicated procedure? Ooh, okay, good question. I think when I was I think root canal treatment is always quite tricky. So I was doing root canal treatment, I think it was on a upper left 6. So I think when I was doing the root canal treatment, it was really difficult to find the canals, because if you guys are dental students or dentists on here, you know how complicated root canal treatment can be, and just finding the canals. And I felt like I was getting really frustrated, because I knew that the patient had been sat there for quite a while, and I was just there trying to find the canals. But then it got to a point where you just have to say, okay, you know what, this isn't working. Explain to the patient. I had to explain to the patient that, okay, so we found some of the canals, but we haven't found the others, and you're going to have to come back for another appointment, and just try and explain to the patient the situation at hand and get them to understand. And it was complicated, obviously, to try and complete it, but at the end of the day, I think it's just really important to get the patient to understand what is causing the delay, and get them on the same page as you. So yeah. Okay guys, I am going to bring the live to an end. Again, thank you for tuning in. I really do appreciate it. Lives are something that I don't do too often, so thank you guys for coming. I appreciate it, and I hope you have found it useful. Okay, hope to see you guys on the next vlog. Okay, bye.